Healthcare in America. It's a topic that sparks endless debates and frustrations. It's a mess, isn't it? Navigating through it can feel like an impossible task. Expensive, confusing, and often leaves you feeling like you need another doctor just to explain the bill. The complexity is overwhelming, but what if I told you there's a billion-dollar industry out there offering a different way? It's called healthcare sharing, a concept that's gaining traction. No, it's not stealing bandages from your neighbor. It's far more organized and community-driven. It's a system where people pool their money together to help each other with medical bills. Sounds crazy? Maybe not. It's about mutual aid and support. Millions of Americans are turning to these programs, ditching traditional insurance for something that feels more, well, human. They're seeking a sense of community. They're tired of sky-high premiums and surprise bills. The financial strain is too much to bear. They want something simpler, more transparent, and dare I say, kinder. A system that's easier to understand and more compassionate. But is healthcare sharing really the answer to America's healthcare woes? Can it truly replace traditional insurance? Or is it just another band-aid on a broken system, a temporary fix rather than a long-term solution? Let's dive in and find out. We'll explore the pros and cons, the successes and the pitfalls, to see if this billion-dollar solution is the real deal. So what exactly is healthcare sharing? It's a concept that's been gaining traction, especially among those looking for alternatives to traditional health insurance. Think of it like a giant piggy bank, but instead of loose change, it's filled with people's monthly contributions. Each member of the community contributes a set amount every month. When someone gets sick or faces a medical emergency, they can request financial assistance from this communal pool. It's a system built on trust and mutual aid. It's like having a safety net woven together by a community, not some faceless corporation. The support is personal and direct, often coming from people you know or have interacted with. Now here's the catch. Healthcare sharing isn't insurance. It operates differently and comes with its own set of rules and expectations. It's not legally required to cover every medical expense. This means that some treatments or procedures might not be eligible for sharing. There are rules, guidelines, and sometimes even faith-based restrictions depending on the program. These guidelines help maintain the integrity and sustainability of the sharing community. But for many, the trade-off is worth it. They appreciate the lower monthly contributions and the sense of community support. They get lower monthly contributions and a sense of belonging. It's more than just financial support. It's about being part of a community that cares. Plus, they know their money is going directly to help someone in need, not lining the pockets of insurance executives. This transparency is a significant draw for many. It's healthcare with a heart, even if it comes with a few caveats. The sense of purpose and community often outweighs the limitations for those who choose this path. Let's face it, traditional health insurance can feel like a bad joke. Premiums keep going up, deductibles are higher than ever, and good luck understanding what's actually covered. The fine print is often a maze of exclusions and limitations. It's enough to make you want to self-medicate with essential oils and a good cry. The stress alone can be overwhelming. For many Americans, especially those who are self-employed or work in the gig economy, traditional insurance is simply out of reach. The costs are prohibitive, and the benefits often don't justify the expense. They're stuck between a rock and a hard place, forced to choose between their health and their financial well-being. It's a dilemma that no one should have to face. Enter healthcare sharing, a beacon of hope in a sea of despair. This alternative model allows people to come together and share medical expenses, creating a community of support. It offers a lifeline to those drowning in medical debt and provides a sense of control in a system that often feels rigged against them. Is it perfect? No. But it's a step in the right direction. In a world where healthcare costs are spiraling out of control, it's a breath of fresh air. It brings a sense of relief and hope, showing that there are viable alternatives to the traditional system.